Good afternoon, everyone. My name is Julia Losciuto. I'm a student physical therapist assistant with Kennebec Valley Community College. And today I'd like to talk to you about blood flow restriction therapy and whether it can be used in an inpatient or acute setting. So what is blood flow restriction, or BFR? It's also known as occlusion therapy, which was developed in the 1960s in Japan, also known as Katsu training. And this technique uses a cuff to apply pressure to a limb, whether it's the upper or lower, and with the intention of occluding venous outflow while maintaining partial arterial inflow. The occluded limb is then exercised at a submaximal level, and this low load exercise with blood flow restriction can increase muscle strength and size more effectively than low load exercises with no restriction. So these are a couple videos that kind of describe what is going on, and it gives you a demonstration of how it works and how the cuff and device works. I will show you this video at the end, and there's also a second video that I encourage you guys to look at in your free time. So the objectives that we will see today is BFR therapy safe and effective? Can this training be used for patients in a hospital setting? And what amount of resistance training can be used with BFR? So for my first, why did I choose this topic? Not many of us have heard of this topic before. I have talked to most of you about whether or not you've heard it, and I think I might have heard from one or two people that have seen it done before. So I figured this would be a great opportunity to teach all of that to you. And also a patient of ours that we recently had polymyositis, and that was the inspiration of this topic. And it's also an interesting topic, which is fast growing in physical therapy. Some contraindications, so any patient with poor circulatory systems, obesity, diabetes, arterial calcification, sickle cell traits, severe hypertension, and renal compromise. And also be aware of any patients with malignancy, open wounds, or risk of clotting. So for my first article, which was called Safety and Possible Effects of Low Intensity Resistance Training Associated with Partial Blood Flow Restriction in Polymyositis and Dermatomyositis. So the purpose of this study was to evaluate safety and efficiency of low intensity with BFR in patients with myositis. Their methods, they had 13 participants with PM and DM in a 12-week period, twice a week. Low intensity of 30% 1 rep max, and they had assessments of muscle strength, physical function, and quality of life. Some of their strengths, they had some successful results. They had very good visual aids, as I will show you in the next slide. Some weaknesses, they had a very small amount of participants. I think they started out with about 100, and then a lot of them were excluded from this, and then a couple had to leave for personal reasons, so they ended up with 13. And then the conclusion was that it was safe and effective for these patients. So this shows graph results of each test that they had. For example, this was a leg press, and then this was leg extension. This one was the timed up and go test. So all of them increased in their repetitions, and then for the tug test, obviously their time decreased. So in overall, all of the results ended up positive. So in my second article, called Blood Flow Restricted Resistance Training in Older Adults with Risks of Mobility Limitations, their purpose was to compare muscle strength, cross-sectional area, physical function, and quality of life in older adults with risks of mobility limitations. Their methods, they had 36 participants assigned to a high load, which is 70% of 1 rep max, and then they had low load exercise, which was 10% of 1 rep max with vascular restriction, for the knee extensors and flexors for 12 weeks, and that was twice a week. Their strengths, they had high amount of older adult subjects with mobility limitations, which they weren't expecting, but they got a great amount of participants. For weaknesses, all of these participants did not have a poor physical function or quality of life despite having muscle weakness before this testing. So therefore, improvements weren't observed for these measures, which in the conclusion, it mentions that everything pretty much improved except for those groups of physical function and quality of life. And you'll see in this next slide, so this is a table of the mean difference in muscle strength. So you have the high load, the BFR, and then the control group. You'll see that both high load and BFR had some increases, and then towards the end, actually the control group came in front. So there's like, there's the, let's see, so the leg curl and then leg press, they had maximum voluntary contraction. All of those were measured. I'm actually not sure how they were measured and they got those numbers, but they had some very good results in both BFR and high load. And for my third article, neuromuscular adaptations to low load blood flow restricted resistance training. The purpose was they compared central and peripheral neuromuscular adaptations and cross-sectional area changes after moderate load or BFR to see impact on muscular strength. And their methods, they had 18 participants, 6 weeks of resistance training with measurements 1 week before and 1 week after. Their strengths, they had successful results, they had a good amount of participants, and they had great visual aids. Their weaknesses, they had the training loads were not progressed, so when they started out with a moderate load, none of the loads were progressed during the training therapy. And their conclusion was they had significant gains in muscular size and strength. And you'll see in this graph, so this was an increase of repetitions throughout the 6 weeks, and the dark line above is the BFR training, and then the horizontal line was the moderate load training. So some patient conditions that can be used with BFR would be ACL reconstruction, myositis, hypertension, osteoarthritis, metabolic syndrome, and COPD. So those are all still in research at this time, but there have been proven results for success. And BFR has been used in athletes and recreational training to obtain muscle hypertrophy. It can also be used in clinical populations that cannot perform high intensity exercises because of the stage of their condition or pathology involved. So overall, the answer is yes. BFR can be very helpful in a clinical setting where patients cannot exercise at a high intensity. These are some of my references, and that is all I had for you. Is there any questions?
In the first article, was there a control group? I was just wondering if there was a control group, how they did compared to the one with the BFR.
Hold on 1 second. No, I believe they did not. They only had the patients with TM and DM.
Okay.
They didn't have a control
They
group.
didn't have one that
No.
wasn't doing, okay. That could be another weakness to their study then.
Definitely. Is there, sorry.
Sorry. Have you done blood flow restriction before? Like that?
I have never heard of this before. I was looking up polymyositis because of our previous patient, and this came up. So I was interested in that, and I took a look at it. And Joe had mentioned he had seen it in an outpatient clinical, but I have never actually seen it done in person.
So to apply the restriction, is there a special piece of equipment you need? Are you just using a blood pressure cuff? What?
It's basically like a blood pressure cuff, and it's kind of like the mobile like screen that we use all the time to do the blood pressure. It's kind of like that in a compact size. I'm actually going to show you that in the slide in the video. But yes, it is just like a blood pressure cuff. Any other questions?
Do we know if our outpatient uses it? Just curious.
All right.
Ask Alex.
Is there, is it like a time co-contraction with, is that how you would coach, or are we gonna find more about that
In the video, it does give you some explanation of how they do it and why. But yeah, you're basically applying the pressure to the spot. The machine will tell you when the optimal pressure is for just a little bit of restriction for the blood flow, and then it stops. And then once the patient starts exercising, it kind of levels out to what it needs.
So obviously, those type of machines would have settings that we could
Right.
control, and
Yes.
we could preset and
Yeah.
lengthen or shorten the times and so forth.
Yep. It has all of that.
Okay.
In the studies, was there like what was the dosing on it? Did they have to do it like, I don't know, multiple times a day or multiple times a week?
So
or?
most of them did it twice a week for a multiple amount of weeks. So basically what you would see in an outpatient clinical, so if a patient came in 2 to 3 times a week, they would do that pretty much every time. So if it were to be used in an inpatient setting, you would just use it 2 to 3 times a week.
I just asked, they don't yet in mind the future, and they wanna know if you wanna do your presentation for outpatient as well.
Oh boy.
Hey, if they want to know about it, that's fine. I'm gonna turn this off.